Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Today is May 12th, and this is another episode of COVID Conversations and More. And more today is Kendra Murray, who's one of our epidemiologists, who's going to be talking with us about something that we haven't thought much about in the last 20 years, but has really made a resurgence, and it's absolutely tragic, and that is syphilis, and especially congenital syphilis. So let's start with COVID, and then we'll move over to the congenital syphilis thing. So in the world, COVID is going down. So in many parts of the world, COVID is pretty quiet. We're still seeing a number of cases in those countries in Asia that did not have a lot of COVID before. So South Korea, Taiwan, Australia, New Zealand are seeing a lot of cases. But because they have high vaccination rates and a lot of people are protected, they're seeing mostly mild cases and are not really seeing a big increase in hospitalizations and or deaths. We're not sure what's happening in China. There are some reports that there are bigger outbreaks. The Chinese government reports that they've kind of kept it in check. But given how contagious the new strains of COVID are, it seems unlikely that you would be able to do this, but this is what they claim. The one place in the world that we're a little worried about is South Africa. You remember in 3 of the past peaks, they started first with cases in South Africa. So, for example, with Omicron, the BA1 variant, this started in South Africa back in November, and they really peaked in December and January and then went down. Then the rest of the world got the BA1 peak in January and February. Then South Africa was the first to have the BA2 peak. That was a small peak and went down. And now they're having a peak of something called BA4 and BA5. These are all part of the Omicron variant, but sort of cousins in the Omicron variant. And BA4 and BA5 are spreading pretty quickly in South Africa. And if history is any word, it's likely that these are going to now to spread elsewhere in the world. The other place we look at carefully is in England. The United Kingdom has been a good barometer of what's going to happen to us 6 or 8 weeks later. So they had their first Omicron surge at the end of December. We had it in February. They then had a BA2 peak, and we're seeing that now. So we're going to be watching. But right now, at least, the United Kingdom has had a decreased number of cases, which suggests that in the next 6 or 8 weeks, we should also see a decreased number of cases. In the US, the number of cases is slightly elevated, certainly not a big peak, more like a little hump. So if you think of the previous peaks being the Cascades, these are like the Coast Range. So not nearly as steep, and not really as sharp, and not nearly as high. And so this is where we're seeing now. Oregon is having about 30 cases per 100,000 per day. We're at about 10 or 15, although over the last few days, we've seen some days over 20 new cases per day. And we're certainly seeing an increase in our case positivity rate. So in Oregon, the case positivity rate is now over 8%, suggesting that the number of cases is really increasing. The good news is that vaccination, especially if you're up to date, seems to work very well. We're having very few serious hospitalizations, and we've not had any deaths in the last month in anybody who's up to date on their vaccines. So vaccines really do work. They're widely available. They're safe. They're effective. So if you're not vaccinated, please start. If you are vaccinated, get a booster. And if you're eligible for a second booster, please go ahead and get that. I got mine a few weeks ago and actually had my blood drawn as part of a blood drive, and it showed an extremely high level of antibodies. So I should have reasonably good protection for at least another couple of months. And I would encourage others to go ahead and get their first or second booster if you're eligible. The other thing that's really good news is that there are lots of antiviral drugs out there, both the injectable bebtelovimab and the oral Paxlovid. So that if you are unfortunate to come down with COVID and are in one of the high-risk groups, please consider getting one of these antiviral medicines, because both of these can decrease your risk of hospitalization and death by 90%. So that's pretty good. When you look in medicine, nothing is 100%. Antibiotics for whatever disease we have are between 90 and 100%. So these are right up there in terms of effectiveness. So if you do get the disease, do start to get sick or in a higher risk group, please talk to your doctor about getting one of these preventive medications. So in summary, looks like we're in another little peak. I would imagine this is going to stay with us for another couple of weeks. but then we would be predicting a fairly quiet June and July. But the wild card and the thing we don't know is about this BA4 and BA5 variant that we're now seeing in South Africa, and that we're going to have to carefully follow to see if that's going to spread and come to us sometime later. So that's what I got for COVID. If people have questions, please send them to us at Facebook questions at DouglasPublicHealthNetwork.org. And we'll collect those questions and do them the next time we meet. But today, Kendra is with us. So Kendra's one of our epidemiologists, and she does a lot of things. But one of the things that she's doing is she's going to graduate school for public health. And in graduate school for public health, she's been looking into congenital syphilis. So I'm an old guy, and syphilis was sort of a big issue in the 70s and 80s when I went to medical school and residency, because although penicillin was very effective, there was still a lot of background disease in the 70s or 80s of syphilis. And over the years, we really got that down. So by the year 2000, we had a relatively low rate of syphilis. And we thought this was kind of gone. We thought this would be a disease of the past. But sadly, over the last 20 years, we've seen an incredible rise in the number of cases of syphilis, and especially syphilis in pregnant women. And so when women are pregnant and get syphilis, they can pass it on to their babies with disastrous consequences. So, Kendra, tell us what you've learned about this congenital syphilis upsurge.
Well, I started by looking at morbidity and mortality of congenital syphilis specifically, and the numbers are just kind of shocking. In 2010, there were 377 cases of congenital syphilis in the United States. And in 2020, these numbers aren't finalized yet. It takes them a little while to finalize them, but there were over 2,000. And that's, I mean, basically that's tripled in a decade, and that's insane. Oregon has mirrored the number of incidents of congenital syphilis, basically the same as the US. From 2015 to 2019, there were 12 cases per 100,000. So they're measuring it a little bit differently there. But now there's 45 cases per 100,000 in 2019. Strangely, that grew faster than the number of primary and secondary syphilis cases in Oregon. And so there seems to be more of a disconnect there, that there's something more going on with just congenital syphilis being missed. And there's just a lot of missed opportunities there.
So congenital syphilis is 100% preventable. So, there's not very much else that's 100% preventable, but we know that if women get treated for syphilis during the pregnancy, at least 1 month before delivery, the babies are going to be okay. But what we're seeing is women are either not getting diagnosed, or they're getting diagnosed and not getting treated. And to give you my experience over 40 years, in the first 35 years I did pediatrics, I never saw a case of congenital syphilis, despite the fact that I worked at inner city hospitals, and never saw a case of congenital syphilis, thinking that, that it's really going down. And now we've had 5 in the Region 3, Region 5 area in this last year. It is just shocking to see this, considering that's also 100% preventable. So how do we prevent? I mean, what's going wrong here? How come women are getting this?
So there's a couple different things I found in studies. And like you said, 2 of the major things, or the missed opportunities there, are women who never seek prenatal care, basically show up to the hospital to deliver and have never had prenatal care before, or that they've had inadequate treatment during their prenatal care. I looked up some statistics about that, and apparently 1.6% of all pregnant women receive no prenatal care at all in the United States. And that, 1% doesn't seem that high unless you start thinking about it as 1 out of 100. That's a lot. They just show up and give birth. A couple of the other reasons that play into it are they may have substance use issues. They may be in denial of their pregnancy. There's still a large chunk that don't attend prenatal care because of financial reasons. And that's a major obstacle. And another thing that can happen, not just in not seeking prenatal care, but inconsistent prenatal care, is unstable housing. And so a lot of people with these types of issues may move around a lot, move from county to county. That makes it harder for a provider or for public health to find them and assist and help get them the care that they need.
Yeah, so there are lots of barriers here, and what we've seen is an increase in the number of young women getting syphilis, which obviously leads to the increase in the number of cases of congenital syphilis. So we're trying to raise the awareness of this. I mean, I looked at the numbers, about 150 kids died in 2020 from congenital syphilis. So that's a lot. So these are babies usually die in the first few months. I compared that to the number of babies who die in car wrecks, about less than 100. And so we're actually losing more babies every year to congenital syphilis than we are to auto wrecks. And all auto wrecks are certainly not preventable, but my goodness, that just is a stunning loss of life. And we've had loss of life here in Douglas County from people with congenital syphilis. And unfortunately, the babies who survive are left with skeletal abnormalities, blindness, developmental issues. So this is not just an issue in the nursery and they'll get over it. This is an issue that's going to plague these kids the rest of their lives. So we're really starting to put a lot of effort. I hope I have seen my last case of congenital syphilis ever. One of the issues is that the medicine used to treat this is penicillin, a shot of penicillin. And those people my age and older can remember shots of penicillin were very common. But the price of that went from a few dollars a vial when I started practice here in 1989 to over $500 per vial. Same medicine. The same medicine, no new research, no new development, whatever, went from a few dollars to over $500. So a lot of clinics are not stocking this because they might not be using it very often. So we're going to be working on a special program to get that drug here at DPHN and then distribute it to those clinics who might need it, because there's really no reason that any woman who has syphilis doesn't get treated promptly and appropriately. So Kendra, you're doing public health, and what's your future goals?
Well, I've always thought that prevention is a lot easier than a cure. And so after working in public health with DPHN for a little while, I decided that this is, where I fit in. And so I will pursue my master's degree as a generalist. So I have a lot of different paths that I can take. And hopefully I get to stay on and do work in health education and community outreach and just help make our community healthier. One fun statistic that I learned starting out was that in the last 100 years, we've increased our lifespan by about 30, 35 years. And if you look at the efforts of public health and clinical health, public health can account for about 30 of those, and modern medicine accounts for about 5. But sadly, the budget for public health in the United States is 3% of the $3.6 trillion that the US spends on healthcare. So I'd like to think that maybe if we could get a little bit more funding in public health, we could do a little bit more to help those with syphilis, primary or secondary, and prevent any congenital syphilis that comes.
Well, that should be our goal. So our goal should be that you and I have seen our last case of congenital syphilis. However, sadly, I think this is probably not going to be true, but we're really going to be making an all-out effort in this next year to go ahead and address all of those background issues that lead to these preventable cases of congenital syphilis. So Kendra, thank you for joining us today. I'm sure we'll have you back in the future when you take over some great job in public health. But thank you for joining us again today. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. If you have questions that you want us to answer, and it doesn't have to be about COVID or anything else, anything dealing with public health, please send those questions to Facebook questions at DouglasPublicHealthNetwork.org, and we'll get to them the next time, which should be next Thursday, May the 19th. But for today, May the 12th, we'll sign off and see you again next week. Thank you.